Okay, so today we're going to be talking about the ethical priorities in our public health. I'm Jenna O'Connor.
I'm Hailee.
Yep. So there's no daily question for this discussion, so we kind of just went off the other group's discussion video. And so in our article, it talked about the diabetes. So we thought we'd talk about the diabetes versus like the COVID situation because they're so different. Because like for diabetes, it's like a individual problem, even though it's like a worldwide problem. Like everyone has like a specific treatment that works for just them. Like if I had it, it might not work for you. So everyone's like different. But with COVID, everyone is contagious and everyone, as of right now, is getting the same treatment. They're all getting shots if they choose to. It's like our own response to the COVID, but not with the diabetes.
Right. And with that comes, the different ways of how autonomy plays into that. And with diabetes, they have their right to refuse treatment, to not follow, some of the guidelines that their health provider provides for them to help get rid of it or help manage it. Versus with COVID, autonomy worldwide is pretty much the same with wearing some people would wear gloves, but wearing the mask and being 6 feet apart were two of the big ones, and everybody has to follow that. They weren't given a choice to not follow it because COVID-19 hit the world. It's not something that was just hit one person and that was it.
Right. And like even though the world is given this guideline for COVID, not everyone's still following it. So like some people aren't wearing their masks, they're not staying 6 feet apart, they're not being cautious, they're just not listening to the guidelines. So that kind of goes against it all. But
right. And restricting somebody's autonomy in COVID-19 is it's for essentially the greater good. You're helping out those around you versus worrying about only yourself. Whether you want to participate or not, it's something that you should do because it's not just affecting you, but it's affecting the world.
right. And some people are very selfish about it and they just think about themselves and not the whole population, because there could be someone with underlying issues. And then if you have COVID and you give to them, they could be worse off than you because they could have diabetes by chance or something like that. So they're worse off and they're paying the price from your decisions.
Right. And sometimes, there's a lot of people that are asymptomatic, so they don't even know that they have it. So keeping these precautions help those people, like you mentioned, be safer, and you're not end up going to be a cause of somebody else's demise.
Right.
As bad as it sounds.
So yeah, that's our presentation.